And we are excited to have in the Best Talks Network studio Dr. David Genecov. He is the owner and director of the Genecov Plastic Surgery Group, one of the best plastic surgeons in the state of Texas, and operates right here in the Dallas-Fort Worth area. Dr. Genecov, welcome to the program.
Thank you, Jim.
All right, let's get right to it. If I come into your place, anyone else come into your place, they want to look younger. There's no doubt about it. So if you're consulting with an individual and they come in and say, hey, I want cosmetic, facial, plastic surgery, what do you do?
Well, anybody that comes to the office is really kind of unhappy with something about themselves. And usually when they come in with an issue about their face, we get comments like, I now have my grandmother's neck, or I look just like my dad, or I'm out there trying to get a job and I'm competing with people that are 20 years younger than me and I look 30 years older than them. How do I get back to a more competitive position? And so we start to talk to them. I talk to them about what their goals are. And so sometimes they think they just want surgery, when in actuality they don't really need surgery at all. They could use some non-surgical treatments with injections or fillers, or even some skin therapy. And those kinds of things will highlight some of the patients just enough so it'll get them where they need to go. Additionally, if they do need surgery, we do a full physical examination and really try to find out what it is that is bothering them. And so it's that detailed conversation with the patient at the very beginning that helps guide what kind of treatment that they're going to get.
Okay, now for an individual that comes into your practice and says, I just want to look better, what do you tell them?
Well, I have them look in the mirror, and that's where it all starts. We put them in front of a mirror and say, what is it that you see that you'd like to change? And so we address the eyes and the nose, the area around the mouth, and the jowl and the neck, and we look at each one of those, and then I begin to kind of move things around for them and show them what it looks like, what the options can be. Then we'll take some pictures and we'll put them on the computer. And I don't use the computer as more of a selling point, as this is what I can do. It's more of a center so that we can talk about what it is that the patients want. Because ultimately, for me, a happy patient is a patient who understands what it is that they want and has realistic expectations.
All right, I find this interesting. Your background is in cleft and craniofacial plastic surgery, okay? So when someone comes in and wants facial rejuvenation or facial cosmetic surgery, what is your approach?
Well, because of my training, I've dealt with all the layers of the face, including moving bones. And so sometimes when we look at aesthetic surgery, it's not just skin and soft tissue. As we get older, the bones tend to recede a little bit. They tend to flatten out as well. And sometimes actually it's moving bone that can give you the projection, which is actually considered very beautiful. In my training in cleft and craniofacial surgery, and actually real good bone surgery of the skull and the face, allows me to approach the patient with a few more tricks in my armamentarium than maybe other people might have.
There we go. All right, Dr. David Genecov, the owner and director of Genecov Plastic Surgery Group. Great to have you. Appreciate
Thanks,
it.
Jim.